A very warm good morning to all the viewers. We are on fourth day of TATVAPRABODHINI, a national webinar series, Ayurveda for COVID-19 pandemic. Today also we have four eminent speakers for the scientific sessions, starting with Dr. Nalini ma'am. Ma'am has completed her undergraduation from JSS Ayurveda Medical College in the year 2002 and post-graduation in Shalyatantra subject from GMC Bangalore. She has teaching experience of about 13 years and specialized in topics like marma therapy and pranic healing. One special thing about ma'am is she is a national level athlete and her area of interest are sports and treating sports injuries. At present, ma'am is working as HOD and professor at Department of Shalyatantra in GNC, Mysuru. Today, she is going to address about the topic sports, physical activities and COVID-19. Welcome ma'am and over to you ma'am.
Thank you. A very good morning to all of you. So today's, rather than saying that it's today's topic, so it has become an topic of every day, that's COVID-19. And you people might be wondering like how sports, physical activities and COVID-19 is, all these are related. So in the ongoing pandemic, so COVID-19 has played a major role where even today the vaccine is still on trials. The phase 1 vaccine and phase 2 vaccine trials are being carried out. But whatever might be the progress in the research field, but yet the COVID-19 stands or it lands up in so-called as immunity. So the sports and physical activity has a major impact on the healthy individual, the well-being, the fitness and immunity. So let's start with COVID-19. So COVID-19, like all of you and even the layman is very familiar with COVID-19 today. So COVID-19 is an infectious disease caused by a newly discovered coronavirus, and people with COVID-19 have experiencing mild to moderate respiratory illness. So, and all of you are very sure about and you are very much familiar with the symptoms of COVID-19 because the phone ringtone itself says like what are the symptoms of COVID-19. So much important is the risk factors of coronavirus or what we call as COVID-19. It's not everyone is affected with COVID-19. Many of us might have experienced with the symptoms of COVID-19 and maybe the symptoms were very mild where it went on unnoticed. The older you are, the higher the risk of severe illness and higher chances of serious illness is with the following conditions like chronic kidney disease, chronic obstructive pulmonary disease, a weak immune system, obesity. And to stress on obesity, there were many cases recorded, even in kids also. Those people who were obese have suffered a lot and maybe with the first day of symptoms and there were death recorded on the second and the third day. And till today, whatever the death records has been stated, and it is all because of the comorbidities, that is especially with the people with diabetes type 1 and type 2 diabetes and people suffering with coronary heart diseases. And even the disease that affect the blood vessels and the blood flow to your brain also can be a major risk for coronavirus. And people with immune suppressant or immune compromised conditions like cancer, HIV are also more prone to the risk of coronavirus. And even the people with diseases of liver. These are the symptoms of long COVID: fatigue, breathlessness, memory and cognitive decline, stress and anxiety, and degrading quality of life. If you just go through the articles which has been published even today, the system that is affected is the respiratory system and the cardiac system and the nervous system. Even the people suffer during the phase of COVID-19 is like the cardiorespiratory symptoms, and even of the post-COVID effect also, the people, there are many cases which are recorded with brain fog. And these are the most common post-COVID signs which indicate a long-term trouble. So one is the heart damage and lung fibrosis, thrombosis, renal damage, and cognitive decline and brain fog. A doctor from Chennai who had suffered from COVID-19, and recently it is reported that even the doctor himself is being suffering from brain fog, where there would be some sort of loss of memory and loss of conscious also. So coming to, so how do we link between the sports, physical activities and immunity? In Ayurveda, it is very well told about the concept of Vyadikshamatva. And we people are blessed that our science, among all the medical fraternity, it is an unique science and it is a sacred science. And the very well told concept is Vyadikshamatva. And the first effort to protect the life from disease and aging is Ayurveda system of medicine. And I'm very happy to share with you people also that today there is a lot of inclination between from the people towards Ayurveda, and people have started trusting Ayurveda because when the concept of immunity comes, it can be with the virus or it can be with the bacteria, or in general it can be with the microorganisms, whatever might be the cause for the infections. Ultimately, the last stand is the immunity. Might be you might have seen that the severity of affection is not unique in it's not same in all the individuals, and that accounts for Vyadikshamatva, which was very long back told in Ayurveda. And Vyadikshamatva is told in terms of Vyadi Bala Virodakatvam, which is nothing but the capacity of the body to fight against the manifested diseases, and which is called as the natural immunity. And Vyadi Utpada Pratibandhakatvam, it is the capacity of the body to resist disease pathogens. So coming to immunity. So immunity is nothing but in biology. It is already told by Chakrapani as Vyadikshamatvam. It is the capability of the multicellular organisms to resist the harmful microorganisms. And there are two varieties of immunity. So the first one is the innate and the adaptive immunity. And the first one, which was told under the Vyadikshamatva, can be called as the natural or the native immunity, which comes under the innate immunity. And whereas adaptive immunity is the immunity that is acquired by once getting affected with any sort of infection or by vaccination. So the central player in the fight against the novel coronavirus is our immune system. You might be wondering, today the discussion is on immune system rather than the vaccine. So very recently, maybe 2 days ago, there was an article published by an microbiologist. So where they claim that there are about 341 projects that has been taken up under the coronavirus, and out of which 41 have been trying for the vaccine. It is worldwide they are trying for the vaccine, but everybody have been claiming that the vaccines are safe, and nowhere it is told that how effective it is. Though the different vaccines have been found out, but there is a question like, does the vaccine, like how the vaccine works in all the individual in an uniform way? What are the antibodies that is produced in an individual? So we do not know like what is the consequence after giving the vaccine. And even there is a claim that there can be many systemic disorders because of vaccine also. So here, and whatever it is, whether adaptive immunity or whether it is a natural immunity, again that counts as immunity. So again, if a person has a very good immunity, so he can fight against the infections in a very well way. So these are the types of immunity. So adaptive, which is an acquired immunity; innate immunity, which is a natural immunity; and again under that there are passive and active immunity. So this is a picture which says about the innate immunity. So innate immunity is the natural immunity where the WBC counts, the number of WBCs in the body, the number of lymphocytes, the neutrophils in the body, how well our WBC fight against the infection at the time of any injuries, or it can be the inflammation. So the acquired immunity is where it can be the number of the lymphocytes and or even the natural killer cells. Here, everything you need to know about COVID-19 immunity. There's a question, why people are affected differently? Maybe the reason is it is because of the genetic pattern in an individual and even the general health. Compared to all the other countries, though we are very rich with the population in India, it is only there are more the cases are recorded, but yet the death rates are very less. And now the study says that maybe in India, in most of the areas or in most of the places, because of the unhygienic conditions, the people have developed the natural immunity against virus. And as part of the health immune reaction, the WBCs are the one which recognize the virus and it releases the chemicals called as cytokines. So this is the immune system which fight against the coronavirus. As we all know, so before we step into the actual topic, so WHO has defined the concept of health as in a very complete way, where it states that it is a complete physical, mental, and social well-being, and not merely the absence of disease. Here, the physical, mental health is very important, and which is considered as health. Sports. So coming to the actual topic, the sports is a double-edged sword. So the positive effect from sports are achieved primarily from physical activities, and secondary effects which bring about health benefits as psychological and personal development. And people active in sports have in general the better health than those who do not participate in sports, because they are physically fit and mentally prepared for the challenges of sports. So we need to know like what is physical activities, what is sports, and what is exercise. So physical activity is nothing but it is defined as purely physiological, as all body movements that increase energy use beyond resting levels. So here the physical activity can include in it can be included under the gross term, that is exercise. So where the more energy is needed to perform any of the physical activities, whereas sports is also a form of, or it is a subset of exercise, but where the participants have a definite goal. And muscle training in everyday language is termed as strength training or resistance training, and that is which is intended to maintain or improve various forms of muscle strength or muscle mass. Physical activities, immunity, and COVID-19. There is lots of work carried out by exercise immunology, which is a new area in scientific research today worldwide, where they are trying to find out like what is the effect of the physical activities on immunity. At different levels of physical activities, there is an impact on the immunity. So the immunity, the human immune system is a highly intricate network of cells and molecules, so designed to keep the host free from infection and disease. So September 27, there was an article produced by Shivagupta, who is a sports analyst, and he is also an owner of a cricket academy in India, who claims that sports has a very high impact on the immune system, and the hormones which is produced during the activities, like either it can be any of the physical activities which includes running, swimming, walking, cycling, or even the competitive sport. The hormones which are released at the time of exercise, it has a lot of impact on the improving the immune system. Improving immunity through exercise, and this is a new advice on lowering the infection impact. Even today, the WHO also recommends that an adult has to exercise at least for 30 minutes for a day, so which is considered as a moderate exercise, whereby it can prevent almost all the systemic disease, like it can be the diabetes, the disease of lungs, and even including the cancer. And almost all the symptoms which is related to these systems are seen in the infection when the person is affected by coronavirus. So here's there is a data which suggests that general health, it makes a lots of difference on how your immune system copes with COVID-19. And I would like to share my experience. My husband, he was diagnosed with the COVID-19, and the reports were positive, and he had been isolated for 17 days. And I had to take care of him for all 17 days. and even my son, who is old, is age about 10 years. And I'm happy to share that I'm very happy, and I lay a good thanks to my sports also, because of sports life. Since I feel that though there was a lockdown period and there was an impact on in almost all the sports field, most of the people were not able to get into their routine with the sports, but yet, so though we are an athletes and we used to have a regular practice, and that made me to deal with my husband's case in a very well way. Myself and my son had no symptoms, and we were negative with the reports, and this is all because of the effect of sports. So during exercise, there is an interchange between lots of change between that happens between the immune cells. It can be the T cells or it can be the B cells and even the NK cells and what we call as natural killer cells. And once you stop exercising, or when the person has a sedentary lifestyle, so all these immune cells will be reduced and the person will be susceptible for infections. If you just look into the picture here, so the immune system, so though it is an acquired or innate system, it has lot of impact on different system, especially the defense cells in the blood, that is the B lymphocytes and the T lymphocytes. So regular exercise, it benefits immunity, and there is a link between the physical activity and the body's defense system. In order to stay healthy, moderate intensity exercise is very essential. There are two components. So one is the moderate intensity exercise, and another one is the severe intensity exercise. And research people from America under the exercise immunology, they have been trying to find out like what is the impact of acute exercise with moderate intensity and the same acute exercise with severe intensity. And the result says that there is a lot of health benefits from acute exercise with moderate intensity, but whereas with the vigorous intensity, there can be the suppression of the immune system and the person can fall ill. And hence it is advised that an acute exercise with moderate intensity can be carried out to stay healthy. Even here, the WHO recommends an adult at least 30 minutes of moderate aerobic activities. So each week, it can combat the threat of heart disease, the lung disease, diabetes, cancer, and depression. These are the highlights of the impact of exercise on immune system. So acute exercise is an immune system adjuvant that improves defense activity and metabolic health. The data support a clear inverse relationship between moderate exercise training and illness risk. And I have been in the field of sports for the past more than 20 to 25 years. But recently there was a gap, and from past 5 years, I am into serious practice. And to share with you all, because since we are in the field of the medical science, so it is a personal experience. So I was suffering from sinusitis, and I had suffered from past for 2 years continuously. And once I re-entered into the sports field, and from 2015 till today, that is till date, I do not know like what is cold. And maybe this is because of the effect of sports and the all the physical activities we do, and that is we are trained up as an athlete. So here exercise training has an anti-inflammatory influence mediated through multiple pathways. As you all know, that is the prostaglandins is released during at the time of any injuries, and exercise is one pathway. It's not directly, it can be indirectly, it blocks the pathway of prostaglandin and thereby inhibiting the action of inflammation. And habitual exercise, it improves the immune regulation and delaying the onset of age-related dysfunction. Maybe everybody considers that we are getting aged, but as per the American science, the young age is up to 65, and it is only after 65 an individual has to be considered as old. But in India, as once you cross the age of 35, so everybody are considered as old. The life starts at the age of 40. Age is just a number. It's not that only the 20s and 30 people can do the workouts. To be frank with, I'm in 40s. But all the workout that is done by an individual who is at the age of 20s and 30s with the same intensity, if you are fit and if you are into regular workouts, you can perform with the same intensity. This is all happens with the regular continuous workout and the practice. And even almost we can prevent almost all the age related dysfunction. And even the physical activities has proved and it has become a protective tool in preventing the consequences of coronavirus. And this is an image where it indicates that what are all the effects of exercise. It calms your nervous system, which is very important today because many people have suffered with psychological symptoms. If any member is suffering from COVID-19 in a family, with no exposure also, psychologically, the other people in the family may also get afflicted with the symptoms of COVID-19. And we people are very much anxious and we are very feared about the coronavirus. But it was seen during the initial days. But as the days passed on from the past September and October, people have used to the symptoms and the other consequences of coronavirus. So the regular exercise, it increases the strength and the function of the muscles, which makes more efficient. And the muscle requires, once you start exercising, the lungs, it takes up the oxygen and it produces less carbon dioxide, which is very much helpful for the functioning of respiratory system. And training also improves the circulation and it strengthens the heart. And exercise can decrease the conditions related to heart, especially the stroke and congestive cardiac failures. So the next slide is why exercise is even more important during the times of stress. Because when the person is under stress, there is a link between the stress and the exercise. When you exercise, the stress is reduced. Even during the period of isolation also, there are many articles which has reported that there was increase in the stress level when the person had a sedentary life, and in a contrary, and when the person started exercising, there was decrease in the stress level. And both genetically and environmentally, there is a link between exercise and stress. So this is an image. Though there is a pandemic called as coronavirus or COVID-19, it is only the students who are even still at home. But there are many employees like we still need to work. And there is lots of stress, whether either it can be in the working place or it can be at the home. But you have to manage this stress in such a way that the chemicals that is released during when the person is under stress, it has lot of impact on almost all the systems of the body. So when the person is under stress, okay, there is a difference between stress and anxiety. Stress is whether you like or whether you dislike, you are forced to do something. But some amount of stress is always needed to carry out the routine works in a systematic way. So why stress has been given more importance is because when the person is under stress, obviously he would land up in anxiety. Anxiety is nothing but it is a sort of worry and fear. And there would be butterflies in the stomach about any of the conditions or any of the ongoing situations or any of the ongoing conditions. And today we have coronavirus in the stomach as well as in the brain. And hence we, in order to bring out these coronavirus, which is in the stomach and in the brain, we need to be free from stress. If the person is under stress and anxiety, and ultimately these two with in conjunction, the person will land up in depression. So the physical activities and exercise, it increases the brain volume, and anti-inflammatory effects of physical activities has proved to reduce the brain inflammation in the neurological diseases. The physical activity may also mediate resilience to stress-induced depression, so through the skeletal muscles. Physical activities also improve the coordination, the movement, and the balance, which is very much important in elderly people. And today there are many records that the person with older age or the elders, they are more susceptible for the outbreak of coronavirus. And it also helps because of very good movement and the strength of the muscles, there would be reduced risk of falls. And also physical activities, it helps to stabilize the blood pressure, the blood sugar, and the cholesterol levels. It improves the state of mind, and the more important is both the body and the mind would be relaxed. And though you eat well, but sleep has been given very much importance in Ayurveda science. The person who exercises, maybe it was 2 years ago, there was a death of a CEO, and he was a very good sportsman, and he used to do exercises daily. But the cause for the death was found out as the lack of sleep. And these are the different ways to boost our immunity. And the first and the foremost thing has been given as adequate sleep and the balanced diet. Why the adequate sleep and balanced diet is it is very much important for the people who with physical activities and sports. The reason is the people who are into the sports, especially the competitive sports, there would be a balanced diet and there would be the nutritional supplement the person would be on, which helps in maintaining the fitness as well as in maintaining the health. And because of the physical strain, the person who is into the sports and the physical activities was also getting very good sleep. So this is an image which shows the effect of exercise on immune system. There is an article which is published by American researchers in exercise immunology, which shows that it's not only with the athletes, it is also with the general population also. The people who were practicing regularly or who were into physical activities on a regular base had less risk of upper respiratory tract infection. And today, the system that is affected in COVID-19 is upper respiratory tract infection. And the person who had a sedentary lifestyle was affected with coronavirus. And hence it is advisable to do exercise in a moderate intensity. But the over intensity or the vigorous training can lead to stress and it can lead to illness. So exercise and your immune system. So exercise, it increases the rate of flow of WBCs significantly. And it is quite common that we sweat when we do a physical activity or sports where the toxins from the body are removed. The rise in the body temperature, it lowers the chance of the bacterial growth in an individual. This is reversing the immune aging clock. And this can be done or this can be achieved by physical activities. The image shows that the people or the age group that is affected with coronavirus, it is the elder people or the people with comorbidity who had a sedentary lifestyle, who lacked the physical exercise were much affected. And there are many articles which has been published and even today, which says that even during isolation, even with the infection also, the person can go with the physical activities. The people who are suffering from HIV and cancer, even the people with these immune compromised people and those who are into sports, there is a very good prognosis with the health. So the exercise release the various proteins that maintain the immunity, particularly the muscle-derived cytokines. And exercise is especially beneficial for the older adults and who are more susceptible for infection during the COVID-19 outbreak. And exercise also, it increases the bone density and the people can remain strong with an advancing age with a young look. So the muscle enhancing physical activity is important for maintenance and improvement in the coordination or balance, especially in the elderly. So although there is no scientific data is not available regarding on the coronavirus, but there is evidence which says that exercising can protect the host, that is a normal individual, from any of the other viral infections. And exercise looks particularly beneficial for acute respiratory distress syndromes that are at the heart of complication of COVID-19. And this is another, again, an image which shows that the impact of exercise on the immune system. The researchers from University of Virginia explored that physical activities seems to play a protective role against coronavirus, and the article was published in March 2020. And there is production of certain antioxidants which might have the protective effect against number of diseases and health problems. The physical activity increases the production of an antioxidant called extracellular superoxide dismutase, which plays a fundamental role in body's defense mechanism in the context of several cardiac, pulmonary, and hepatic pathogens. During exercise, the two important organs that come into picture is one is the lungs and the heart. The lungs, which it brings the oxygen into the body to provide energy, and it removes the excess of carbon dioxide, and the heart pumps the oxygen to the muscles that exercise. So here, so this is an marma therapy. And marma therapy is again a unique contribution from Shushruta in the field of Ayurveda, where a normal individual can practice with marma therapy. And I have been practicing with marma therapy for the past 3 years, and I have found very good results. Where for an instance, Talarudaya marma, which is present in the middle of the foot in the sole. And if this particular point is stimulated in a normal individual, so it normalizes the function of the respiratory and the cardiac system, and it also boosts up the immune system. And there are many articles and there are many research papers which has been published with the efficacy of marma therapy. Marma therapy can be done both in a healthy individual as well as the person who are suffering from the ailments also. And marma therapy, it is mainly, it comes under the science called as reflexology, and it works by triggering principally the blood gate reflexes with some influence over the nerve gate reflexes as well. So the combined effect of marma therapy and pranic healing, which I do practice. So usually it releases or it unblocks the energy channels that is blocked by the stress. Why I am laying more stress on stress is because the stress is the main for almost all the pathologies that is encountered today as lifestyle disorders. And almost all the lifestyle disorders that is being discussed worldwide today, and the system that is involved even in case of COVID-19. These are the benefits of marma therapies. It balances the saptadhatus, it stimulates the immune system, and it strengthens the defenses. It is a rejuvenating effect. It relieves stress and emotional depression, and it reduces the physical and mental fatigue. Along with marma therapy, so going into like once in 15 days or once in a month, what you call as padagata or that is the massage with the foot. It relaxes the body and it has a very good effect in maintaining the health of an individual. So rather than always be thinking of like, we do not know like when the vaccine is going to be introduced into the world. So until then, though the vaccine is introduced or though we are immunized with vaccine, it is always an adaptive vaccine. But still what counts is our immune system, how well our immune responds to the vaccine, or it can be the other viruses or anything else. So ultimately, the prevention is the best key. Whatever, today it is corona and tomorrow it might be another virus which can affect the humans. But ultimately, the thing will end up is the immunity. And the immunity can be well boosted up with the sports and the physical activities, because there is a lot of impact and there is a profound impact of sports and physical activities on immune systems. And it's an advice that make an habit of exercising daily. It's not the age that counts. Depending upon the age of an individual, the sex, and you can vary with the intensity of the exercise also. You can do the acute exercise, moderate exercise, and vigor exercise. There are many people in veteran science or in veteran sports, where people with aged about 90 and 100 also, they do run with the same timings, with the timings which is given by an kid at the age of 12 and 14. It is all that you boost up your immunity. It is how you plan and how you manage your stress and how you boost up your immunity by sports and other physical activities, with the key of prevention and exercising daily in order to prevent the ongoing coronavirus and even the future viruses also. So exercise is very important. And with these few words, so we can fight the coronavirus together. Thank you, one and all.
Thank you, ma'am. Thank you for sharing your valuable knowledge of role of different sports and physical activities in improving immunity and the role of marma therapy to combat the COVID-19. Thank you, ma'am. Speaker of today's second scientific session is Dr. Mythrey RC ma'am. Dr. Mythrey RC ma'am is an adorable clinician and an eminent resource person from the Department of Kaya Chikitsa. She has graduated and post-graduated from Government Ayurveda Medical College, Mysuru. Along with the general medicine specialty, Madam has super specialization in Ayurvedic dermatology and working in the same field since 15 years. She has also developed traditional Ayurvedic cosmetology department in GMC Mysuru. Madam is also awarded with additional postgraduate diploma in yoga education with therapeutic yoga and clinical cosmetology. At present, Madam is working as professor in the Department of PG Studies in Kaya Chikitsa. She is also a guide to PG students, principal investigator and co-investigator in few researches conducted in the field of Ayurveda. And today she is going to present on the topic empirical and comprehensive management of COVID-19, an Ayurvedic perspective. Welcome, ma'am, and over to you, ma'am.
Thank you, Dr. Amita. Namaste, everyone. Today, my topic of discussion is empirical and comprehensive management of COVID-19 and Ayurvedic perspective. We all know that there was a sudden advent of the disease COVID-19, presented itself as a grave disease by being highly contagious in nature. This has put the medical world in such a fix that it is in search of a medicine which also should advent to destroy this deadliest viral disease. The story of the origin of COVID-19 gives us an idea of Agantuja Vikara with special reference to the class of Bhutabhishanga, that is microbiological etiology. The symptoms resembles with Vatakafachwara and Sannipatachachwara in broader sense. And the treatment will be based on the symptoms related to the involvement of dosha, proclaiming dosha pratyanika chikitsa and vyadhi pratyanika chikitsa. Along with the preventive measures, the management of Agantuja Vikara follows the line of Nija Vikara itself. So here, the management guidelines is based on the principles of Jvara Shamana, Kapha Dosha Shamana, Vatanulomana, Pitta Samyata, with concentrating more on balancing the Ushna and Ravaguna of the Pitta, along with the protection of Rogi Bala. Because our science has given paramount importance to the factors that strengthen the host defense mechanism, that is Bala or Vyadhi Kshamatva. In fact, our health depends on the Bala of an individual, and the administration of treatment also depend upon the Bala eventually. Considering the global population, we can infer that the reach of Ayurvedic treatment is limited only to our country, or only in the places where Ayurvedic science has proclaimed its status, and also in the places where people show interest in taking Ayurvedic medicines. But it is the dream of the whole Ayurvedic fraternity that our science should reach all over the world. It should be given scientific status and worldwide acceptability. In the current situation, there is a challenge which needs to be addressed through a multidimensional approach, because the standard treatment protocol of modern medicine have limitations in addressing immunological and mental health problems. And the present standard allopathic care for COVID-19 is empirical, and it is based on certain possible characteristics like antiviral property, medicines having antiviral property, cessation of viral RA replication, anti-inflammatory property, and activity on interleukins and structural resemblances, etc. In a similar manner, the Ayurvedic fraternity has also developed a treatment protocol based on Ayurvedic treatment principles which are being in use since centuries, and they are time tested for their effectiveness in clinical use as pathophysiological modulators, immune modulators, antiviral, antipyretic, anti-inflammatory drugs. They have even shown good results in treating viral infections with similar COVID 19 like symptoms. Therefore, the drugs or the formulations are repurposed to treat COVID 19. And the drugs or the formulations which are being mentioned in the future slides are also considered, or I want to say, I want to repeat the same, that they are repurposed to treat COVID 19 conditions also. The safety of these medicines are also highly appreciable. These medicines also keeps the psychological health of an individual intact. So these benefits of Ayurvedic medicines is very openly seen. And of course, to be more precise and to give evidence-based answers, several observational, preclinical, clinical studies and other R&D initiatives are being engaged. We don't know, they are of course looking, everyone are looking for the invent of a new medicine which fights or counteracts COVID-19 effectively. Say they are in search of the vaccination, but how far it works, how effective the coming vaccination will be, or how it will be helpful in treating or curing the patients or in preventing these symptoms to develop. But still, as an Ayurvedic practitioner, I am I pledge that whatever new research come up, but still what Ayurvedic treatment protocol is present, and we are using it, and with the effect of these medicines will definitely help in treating whatever type of diseases the humankind is facing. So, with these highlights, I would like to proudly acknowledge the Ayurvedic empirical and comprehensive management for COVID 19. As we all know, based on the symptoms and the condition of the subjects, usually the subjects are categorized under four groups. Target or group one, target group one. Here, the subjects of non-infected and quarantined and home isolation subjects are considered for the management, or here the treatment principle will be following as per the preventive or prophylactic treatment. And the subjects with mild to moderate symptomatology of patients are come in target group 2. Here we are also, according to their symptom, we are also treating with we are giving Ayurvedic symptomatic treatment along with supportive Ayurvedic treatment. Supportive Ayurvedic treatment here, it is meaning as the patient is on Ayurvedic therapy, and other than flu-like COVID symptoms, if the person who is suffering from any other systemic disorders, also for those disorders also we can add Ayurvedic supportive therapy. And target group 3 comprises of severe symptoms of COVID patients, or the patients with comorbidity, and also the immune compromised conditions. The persons suffering from immune compromised conditions are subjected to this group. Here, integrated approach is needed, or it may be essential, though Ayurvedic management will be present depending upon the severity of the disease, severity and the bala of the patient. Ayurvedic management may not be totally successful or or it may not be a complete medicine, wherein we may need the help of the other allied system of medicine. So here, because of the already present comorbidity and already present immune compromised condition, we may need integrated approach. And in target group 4, the patients who have already recovered from the COVID-19, such subjects are categorized under this group. And for them, usually restorative, recovery and rejuvenation type of therapies are advised. So these are the common principles which have been dealing with since March, since the month March, wherein serious lockdown effect because of the effect of the COVID-19 has started. And since then, all these therapies, what I'm going to share in the next slides, are already being tried regularly being trying, and the acceptable or good response from the treatment are being expected from the present treatment. So let us go with the treatment modality or the management modality, how we are doing in the Ayurvedic field. So for the target group 1 subjects, they are having no symptoms or they are not yet infected, but being in the public, being in the mass population, everyone should be aware of this global pandemic, and don't neglect. They should never ignore any measures to be taken to keep themselves healthy, clean, and free from from catching up any type of discomfort. So, and the first and foremost thing they have to follow is the maintaining of hygiene, their personal hygiene as well as the environmental hygiene. They should follow the simple etiquettes like cough etiquettes, how you should follow, how you should take care of yourself and in the public without disturbing the public, and always wear mask and use sanitizers on and off very frequently, and wash your hands frequently. All these hygiene techniques which is already told, being telling since many months, and it is uh, satmya, which has become satmya to everyone, but still these things has to be continued, and we should maintain social distancing. And of course diet is very important. We should always maintain the healthy diet. We should cope up with the stress, never get angry or never get depressed because of the present situation what each and everyone are facing in a different way. And just to cope up with the stress, go with regular exercise and meditation, take adequate sleep. And along with that, our Ayurvedic gem of explaining dinacharya should be followed, and of course immune enhancers has to be consumed. So the dinacharya, or the daily regimen, the classical regimen is already present, and all our Ayurvedic fraternity is well versed with it, but still practicing it or implementing it in day-to-day life is needed, and it should be repeatedly remembered or repeatedly made remembered by others also to keep in regular practice. First of all, for the present situation, we need to go with the regular intake of hot water or medicated water. And Charaka Samhita, in almost all the diseases, we find the reference of medicated water based on each and every disease. But here, for this COVID-19, even Ardhaka Jala, or it is a simple procedure of preparing medicated water. Just put these medicine or herbs, raw or dried herbs, in a small piece of herb into a big 3 to 4 liters of water, boil it, and just consume it regularly. So it helps in maintaining the, or it balances the doshas, it keeps the Agni intact, and allows the whole physical and mental status of a person to stay in a healthy way. It's a simple remedy, but still it helps a lot. And instead of consuming more of regular tea or coffee, or in between regular tea or coffee, you can once in a day or twice you can consume tulsi tea, which you prepare by boiling tulsi, shunti, maricha, dhanyaka, and tea. And even golden milk, known to everybody all over the world, everybody are using this, but still it is really a golden medicine for the public. Though these two are home remedy, it is also incorporated in the suggestions formed by the core committee who is developed for this protocol development for the benefit of the public at large. Next is we should every day after washing our face or brushing your teeth, gargling, make it compulsory to gargle with either Haritra water or Triphala water or Ishtimadu. And here it is mentioned to add little pinch of tankana. Tankana you can add when you have sore throat or any discomfort in your throat, or else just simple Haritra Jala, Triphala Jala is sufficient for gargling. Steam inhalation, yes, whenever you go out and come enter the home or enter the workplace, if you have the facility, it's better to have once or twice in a day to inhale the steam. The steam also, rather than using plain water, you can use the water boiled with tulsi or ahitra. Too much of consumption of steam is also not good, but you have to be in, what I will say that you should know your body. What are all the minor changes is happening inside the body? It is if you're feeling too much dry, stop steam inhalation for 1 or 2 days and go with the next practice of regular practice of Pratimarshanasya. Just apply or smear oil to your nostrils. We usually prescribe medicated oil, but a simple coconut oil can also be used. Smear it to the both the nostrils, and this is of course proven in our science, and it is we also see in our day-to-day practice that if you smear the oil, it keeps your Gnanendriyas intact. Along with that, no dust or any germs which you cannot think of it, nothing can enter your nostrils. So that practice of applying or using Nasya is very important, or just putting one drop or just smearing is also helpful. And of course, the Upana, keeping your environment free from any unidentified germs. Our concept of Dhupana, putting dhupa around your environment is very helpful. You can use Rakshokna Dhupa or Dashanga Dhupa or Nimba, Harira, Tulasi, Vidanga, Lashuna, Agaru, Gukul, etc. There are n number of single drugs which can be used for Dhupana. Then, as I said, diet is very important. Consume easily digestible light food. Avoid heavy, spicy, oily, or fried food, junk food, school drinks. It is known to everybody, but still control consuming the unhealthy food. Avoid mental stress and avoid exposure to strong wind, even fan or ACs. When you have any signs of pratishyaya or kafaja lakshanas, please avoid these things. And you have to take extra care after head bath if you're if you're having Shirashula or Shirogaurava or pratishyaya lakshana. Just rub a few little quantity of Rasnari Churna over the scalp or the bregma area. That also takes care of the minimum variations and will be fine for the next days. And of course, immune enhancing supplements has to be taken regularly. These are the most safe and effective single drug medicines. That is what I'm going to tell is about ashwagandha, guduchi, amalaki, HT, and even pipali. These can be consumed regularly and they act very effective in primary prevention. The single drugs help in enhancing individual immunity and acts as reducing exposure to the pathogens, restricting the entry and arresting progression of the disease. Guduchi and people, many scientific studies about these single drugs have, a number of studies have already done, and all studies have proven that Guduchi and Pipali as we can use as a standard care in all the stages of treatment in this COVID-19. And ashwagandha, especially, it is used as a standard intervention for prophylactic care against COVID-19. So coming to the target group 2, management of the target to group 2 patients, wherein we are giving Ayurvedic symptomatic treatment and also the Ayurvedic supportive treatment. Coming to the COVID-19 symptoms, I'm not dealing with a specific pathology or symptoms, everything. I'm just directly going into the symptom and its treatment. So if the person, the initial lakshanas will be jwara. So you can begin with Mahasudarshana Ganavati and Amrutarishta, the doses as per the classics, reference as per the classics. And you can also add Balaji Rekadichala or Arkayavani. This is to again keep the Agni intact and maintain the Deepana Pachana level of the digestive system, and also to control the Jwara, and also to take care of the Aruchi. Okay, and if the patient is showing some Vataja Lakshanas, increased Vata Lakshanas, then you can administer Samshamanivati, 500 mg, 2 tablet BT after food, and along with Amrutottara Kashaya, 15 ml TID with water before food. If there is uncontrolled fever with myalgia, then Mrutyunjaya Rasa, 125 mg TID with water can be administered. And if the patient is going with Kafaja Lakshana, again Shiro Gaurava, Shirashula, Pratishyaya, along with Jwara, then Tribhuvana Kirti Rasa, 125 mg BD after food with Shunti Jala or water is effective. All symptomatic conditions based on dosha, amsha, kalpana, you can think and administer these medicines. And if the patient is associated with galashula or galashofa, some inflammatory condition in sore throat, then the regular etiquette, what I already explained, like gargling, gandusha, and steam inhalation. And along with that, Vyoshadivati, Lavangadivati, or Kadiradivati, this can be chewed or taken internally with water, 2 tablet TID. And even Lakshmi Vilasa Rasa, 125 mg TID with Tambulasva Rasa after food is also effective. And if pratishyaya is giving problem and both the conditions like running nose or the nasal congestion, then administer Haritra Kanda 3 to 5 grams BD with lukewarm water or milk. Lakshmi Vilasa Rasa 125 to 250 mg BD with Ambulasvarasa after food, or along with Dashamularishta and Amrutarishta in combination for about 15 to 20 ml BD with water. If the person is suffering from more of Parshashula, Shirashula, and Angamala, or more of myalgia is along with all these pain, then you should administer Rasna Saptaka Kvata or Balarishta, or Rasna Saptaka Kvata along with Balarishta, or Devadarvadi Kvata along with Dashamula Katatraya Kashaya. If the person is showing the Agni level, his Agni level is becoming down, then you can keep up, maintain the Dashamula Katatraya Kashaya, or you can continue this Kashaya, giving for 10 to 20 ml BD before food. And if the Shirashula is more, then Godanti Basma 250 mg BD or TID daily with Sita or milk or water is suggested. But Godanti Basma along with the Pravala Pishti and Abraka Basma, in the combination of these three, is very effective in combating the Tridosha Lakshanas. Even it will be very effective in COVID-19 condition also. Coming to the CASA, most of the cases will be of dry cough. So in treating this, we have to add Sitopaladichuna, Thalisadicuna, Madhuyashtichuna. If you add Madhuyashtichuna, the formation of the uneasiness which develops is very quickly taken care by Madhuyashti. And for the dosage, as mentioned, like 4 gram, 2 gram, and 2 gram, BD with honey or warm water is suggested, along with Vasakasava or Vasavaleya. Vasavaleya here in the liquid form. It should be in the liquid form. One company in our place in Mysore, it is available. It is very useful in this condition. Even Vasakasava, if Kapha Vata and Kapha Lakshana is more, than Vasakasava can be administered. Likewise, Dashamula Katutrayadi Kashaya, as I said earlier, you can maintain, or if you want, if the patient seeks it, can be continued. In Shwasa Pradhana Kasa, wherein mild pneumonia-like symptoms are started to develop, then add Shwasa Kutara Rasa or Shwasa Kasa Chintamani Rasa, 125 mg TID with warm water after food, along with Talisadi Churna plus Madrishta Churna, Samira Pannaga Rasa 125 mg, all powdered and mixed together and administered twice a day with honey or lukewarm water. Even Kanakasava or Pushkara Mulasava, or both Kanakasava and Pushkara Mulasava in combination can be administered for about 15 to 20 ml BD or TID depending upon the requirement of your patient. Likewise, Dashmula Katuprayadi Kashaya can be continued. Even this not only maintains the Agni, but it is very effective in controlling the Kapha and Vata Dushti variations. It controls these variation, and it is very effective in combating the disease. Then Barangyadi Kwata also can be administered. It acts as bronchodilator, wherein the person feeling a lot of breathlessness, these two combination helps in clearing the problem. And even for that, better medicine is Chandramrita Rasa in 250 mg BD with Tambulasvarasa or Vasasvarasa or Ardrakasvarasa along with Madhu should be administered. Even Agastya Haritaki Rasayana or Chitraka Haritaki Rasayana or Kantakaya Valaya also can be administered, but you should assess the condition of the patient, wherein if the Kapha Lakshanas are more, then after the disease progression is under control, then in the latent state, you can add these avalayas of about 10 to 12 grams BD after food with water. As I said in the categories, if we need Ayurvedic supportive treatment, as I said, because the patients along with the COVID symptoms, if they are present with other Srotovikriti, if they are already having the Kavaiguni and other Srotas, so simultaneously they will be facing the problems related to that Vikrita Srotas. So if your patient is having digestive disorders, then along with other treatments, we should add Dadimastaka Churna around 3 to 6 grams, which should be administered with lukewarm water or tapra, or even instead of if you don't find Dadimastaka, even Ashtachurna is okay, but better is Dadimastaka Churna or Kapipastaka Churna. Then Agni Tundivati, 1 tap TVID before food is also advisable, and even Bilvadivati also rectifies the variation in the colon. And coming to the patients who are having the liver disorders, who are prone to get liver disorder, or who is already susceptible with the liver condition, for them, Amalaki Churna 3 to 6 grams or Tripala Churna 3 to 6 grams in empty stomach and should be administered in the morning. And or Kalamaiga Churna also can be administered, or preferably Kalamaiga Churna 3 to 6 grams on empty stomach in the morning with lukewarm water for 20 to 25 days may be required for them to get rid of their problem. And these medicines also act as liver protective, so it can be administered, and if in need, the patient may require some other additional medicines which need to act on the liver. Likewise, coming for the nephroprotective drugs, it is Punarnavasava, around 15 to 20 ml with equal quantity of water. And along with that, a combination is Gokshura 2 tablets with 250 mg of quantity, and either BD or TID depending upon the condition of the patient. These two medicines are sufficient, but still, if our patient requires more treatment, then later on you can add Chandraprabhavati 2 tablets, BD or TID with warm water, depending upon the condition of the patient. Now, continuing with the psychological status of the patient, if our patients are depressed or stressed or fearful, of course, counseling is needed. And along with that, if your patient requires any medication, then always these medicines stand in front. That is Saraswatarishta 15 to 20 ml with equal quantity of water, or Manasamitravati, or even Brahmivati 155 mg TID after food can be administered. And even Shankapushpi syrup also is very effective in relaxing the mood of the patient. It can be administered of about 15 to 20 ml with equal quantity of water. Now, in introduction, I was telling about the Agantuja Vikara, and this is considered under Agantuja Vikara. Okay, so many doctors have even tried this Kriminashaka concept of treatment also, and even we tried, and in some patients this was also found effective, or it has also shown some improvement, better changes in our patients. So it's natural Kriminashaka, not natural, it's a very common known Kriminashaka dravyas like Vedanga Churna, 2 to 3 grams with honey at night after 1 hour of meal. Even Bilva Digutika, taking care of the intestine as well as the krimis, is effective in treating this condition. And Bhumya Malakiswarasa, which is very proven to be as antiviral drug, this Swarasa was also administered for about 15 days, only for 15 days, for about 15 ml on empty stomach for 15 days. So coming to the target group 3, wherein the patients are little in the level, little more than the moderate level, and into the severe state of problems. So here, along with the Ayurvedic treatment, the integrative management is needed. As I said earlier, this is a stage wherein critical care may be essential for our patients. So, integrative approach has to be applied here. And this integrative management, I'll tell that it should complement each other, and it should complement the strength of modern medicine in critical care, and we should complement the strength of Ayurvedic medicine in strengthening immunity, besides providing better recovery rate with less chances of disease progressing to severe form. And it acts as add-on therapeutic intervention. It is for this statement is for both the systems, Ayurveda treatment can act as add-on therapeutic intervention, or allopathic system can act as add-on therapeutic intervention. Again, all these principles will be based on the individual status of the patient. Individual patients have different level of suffering, different stages of suffering. So based on different stages, different line of treatment has to be complemented and administered. Besides this, if we want to concentrate only on Ayurvedic treatment, over to this superficially, if you over or above all, if you want integration of other system, it can be done. But what Ayurvedic medicine has to be applied in Shwasa or acute respiratory distress syndrome is Shwasa Kutara Rasa with Kantakari Churna 2 grams and Pipali Churna 1 gram. It should be mixed with Madhu or Guda and administered. Even Chaushashta Prahar Pipali 125 mg plus Saindavallavana of 1 gram and Madhu mixed all together, and this should be administered BD with warm water. Even Malla Sindura 125 mg plus Thalisari Churna 3 grams plus Abraka Basma 125 mg all mixed together with honey should be administered twice daily after food. The choice of selection of these medicines are left to the choice of the Vaidya itself. And along with these medicines, even local application of Saindhavadi Taila over the chest, followed by Nadi Sweta, can be tried, which gives a good amount of relief to the patient. Or you can try this until the patient is until the patient will get the alternative supportive treatment. And I want to share the combination of 3 basmas. One is Ingula basma, Abraka basma, and Rasa Sindura. This combination is used to minimize progression of respiratory infection. So to minimize the progression of the deterioration of the lung capacity, lung functioning, we can administer this combination of medicine, and it is being showing good results. And the another combination is the 3 combination of Swarnamalini Vasanta Rasa, Arogya Vardhinivati, and Purna Chandrodaya Rasa. All these 3 should be administered to arrest Dhatupaka. Dhatupaka is a condition wherein, as the disease progresses, it has when the disease has reached this stage where we are subjecting the patients to the group 3. In this stage, already the Tridosha Vaishamya has reached to the peak. Here, the vitiated Kapha dosha and Vata dosha alters the status of the Pitta. As I said earlier, Pitta Samyata should be maintained. If the Pitta, the actions of Ushna Guna and Drava Guna of Pitta is increased, or it increases because of the vitiation of Kapha and Vata, and what happens then, the status of Dhatu Paka develops in the body, and this stage is considered as the critical care, or wherein it is severely affected, or more over moderately and severely affected conditions. When the patients attain this stage, then the Dhatupaka level is understood. So to combat this condition, or to suspend the further progression of Dhatupaka, and to balance or to normalize the Dosha Vaishamya, Swarnamalini Vasanta Rasa, Arogya Vardhinivati, and Purna Chandrodaya Rasa is administered. But these medicines should be administered very cautiously, and seeing or checking each and every moment of the condition of the patient, and has to be done. Coming to the comorbid states of our patients, or if the patient is associated with diabetes, as having diabetes already, and along with other regular COVID treatment, what we mentioned, or standard treatment already, which he or she is taking. Along with that, we can add Nishamalaka Churna and Musta Churna, around 3 to 6 grams PD with water before food, or even we can administer Jumbo Churna, 3 to 6 grams with water before food. If there are more number of complications of diabetes seen in this patient, then we can also add Vasanta Kusumakara Rasa, 125 to 250 mg PD with water after food. Even Abraka Basma in certain cases of diabetes with little complications are found effective After administering this Abrakabasma around 125 to 250 mg twice a day with Triphala Kwata or Guruji Swarasa or Ardhaka Swarasa. Ardhaka Swarasa we have to check before administering along with Abrakabasma. If that Anupana is needed for your patient, then only we should add Ardhaka Swarasa. Coming to the patients with cardiovascular disorders, Ashwagandha Churna plus Arjuna Churna, each 3 gram, are administered with milk or water before food. And Prabhakaravati, 125 to 250 mg TID after food, is administered in patients with history of IHD or MI. Hridayarnava Rasa is also suggested. This medicine of about 125 mg BD after food is suggested for the patients with Kafaja Hridroga Lakshanas who is having heaviness in the chest or difficulty in breathing along with the cardiac disorder. Then Hridayarnava Rasa is helpful. Even Arjuna Arishta, it is very good in controlling the condition. Around 50 to 20 ml BD with equal quantity of water after food should be administered. All in all, to protect our heart, even Madhipala Rasayana around 10 to 12 grams BD can be administered. Patients with renal diseases, renal complications, along with other treatment regular protocol, they should also consume Dashamula Guruchi Kashaya, freshly prepared 30 to 40 ml BD before food, or even Varunadi Kwata is fine, and even Trinapanchamula Kwata, freshly prepared 30 to 40 ml BD is advisable. And patients with vascular deformity or disorder, if they ever find any vascular disorder, then add Kaishwara Gugulu 250 mg BD along with Mahamanjishtadi Kada 15 to 20 ml BD with water after food. And even Guduchyadi Kashaya instead of Kada, or both Mahamanjishtadi Kada and Guduchyadi Kashaya can be administered. And Lashuna Kshirapaka around a single dose in the morning of about 30 to 50 ml is also advisable. If the patient is having Pitta Prakopa Lakshana, then check these Lakshanas and then administer Lashana Kshirapaka. And if the patient is on any blood thinning medicines, then also Lashana Kshirapaka should not be administered, but see the dosage of all the medicines, and as and when required, only then we should be very keen in administering these medications. Now, for the immunocompromised conditions or the patients like immunocompromised status having as in HIV or in carcinoma or even in tuberculosis patients or any other immunocompromised condition, along with, of course, their regular treatment has to be continued, and along with that, just to maintain the status, normal status, we can add Shamshamanivati, 500 mg 2 tablet BD after food, along with either Chavana Prashavalaya or Ashwagandha Valaya or even Agastya Rasayana, and even regularly administer Ashwagandha Churna 5 grams BD with milk. These medicines are advised even for the persons who are the caretakers of these immune compromised sufferers. So coming to the target group 4, here the subjects we categorized, or the subjects who come under this group, is the people who have already combated or already gone through the pathological phase and recovered, and slowly they have yet to recover or they have already recovered. The 2 categories of people are also in this group. The people who are having mild to moderate symptom and who are recovered very fast, even they can consume the medicines which are being told here for few days. And the people who had moderate or little more severe conditions should continue these medicines for some more days. First one is Indukanta Kashaya, around 15 ml with equal water twice before food, along with Mahasudarshana. Ganavati is suggested. And even Amrutarishta and Dashamolarishta regularly, in a combination of these 2 medicines regularly, of about 15 to 20 ml with equal quantity of warm water twice after food is suggested. Even Draksharishta can be consumed in the same manner. And Ajamodadi Churna or Panchakola Churna, this is to maintain the Agni or to balance the digestive system variations, should be administered in the dose of 3 to 4 grams with lukewarm water before food, either TID or BD. Even Panchakola Asava is also very effective in taking care of the after effect and making the digestive system come back to the action quickly. And along with these medications, we should never forget the rasayana. Consumption of rasayana has to be continued. It can be Drakshavaleya or Vasavaleya or Kantakarya or Chavanprashavaleya or Ashwagandha Avaleya. Again, depending based on the doshas, like Drakshavaleya in Pittaja Lakshanas, we can administer Vasavaleya Kattakar in Kapha predominant condition, Chavanprasha regularly without with mild symptom or without symptoms can administer, and even Ashwagandha Leha goes with the same line. And if at all the person has suffered previously, if the person has suffered from respiratory disorder, severe discomfort, having respiratory problems, after recovery, that person should be administered with Vardhamana Pippali Rasayana for 15 days to 1 month. That according to these days, 15 days to 1 month, the dosage of Vardhamana Pippali also has to be rearranged based on the condition of the patient. So the treatment, application of the treatment is over, but along with the treatment, along with the medications, diet, following the diet or patya is very essential. Our speakers in the previous classes, previous presentations have dealt in detail about the ahara, what type of ahara should be consumed in different stages of the COVID-19 disease. But I won't get into the diet properly in detail, because in all the stages of the condition, from especially from the stage 2, stage 3, in the stage 3, and of course even sometimes in the stage 4, the medicated diet, what is suggested in our Ayurvedic classes, if we follow this, I think it is very, very helpful. Controlling the tongue, controlling eating the tasty food is not easy for everybody. But in between the regular meals, I will suggest or I advise to consume the advised medicated diet in between at least. So it can be a gruel prepared using rice or barley or suji, which is processed with pipali or dashamula or maricha or adraka or all in together. And larger peya with madhu should be administered. Peya prepared with dadi marasa. These two diet patterns must and should be applied in stage 2 and stage 3 condition. Better not to consume any hard food. Only if the patient is going with these type of light food along with the medication, the recovery rate will be faster, and it will be and earlier also. And even yusha prepared from mudga and kulata, and you can administer mudga yusha in the vataja pittaja condition, in kulata in vataja lakshanas. If jwara is associated with atisara, then definitely diet takes a lead role. Even medicines may not be, maybe medicines also may be irritant for that person. In that state, diet plays a very important role. There, patient should be administered with yusha prepared from either musta, that is the kashaya prepared of musta, guruchi, kirata, pitta, and adraka. And this kashaya should be used to prepare the yusha or yavagu, and that diet should be administered for patients suffering from atisara and even jwara. And of course, Shadanga Paniya, it's a drug of choice, an ORS of Ayurveda. In all the stages of COVID-19, starting from first to the end, and in between, and especially in the jwara time, the person when he is having jwara, this water, as I said earlier, like you have to use medicated water. Likewise, this Shadanga Paniya, if you use like medicated water every time, the pathology will be taken under control very quickly. So with these lines, I would like to conclude by saying that the Ayurvedic medicine protocol set by eminent Ayurvedic doctors across the country is also empirical. The usage of the medicines in clinical management protocol of modern medicine stands on the same line. So most of the current therapeutic options used for critical care are expensive and are associated with serious adverse events. Therefore, the most safe and cost-effective strategy is primary prevention by enhancing individuals' immunity and reducing exposure to the pathogen, restricting its entry and arresting progression of the disease. And these pattern or this management can be very well accomplished by Ayurvedic protocol. And Ayurvedic medicine has shown to be efficient in dealing various symptoms related with COVID-19 and also in improving the physical and psychological well-being. Empirical evidences drawn through interim analysis of ongoing studies on Ayurvedic medicine for prophylaxis and management of COVID-19 is showing encouraging responses. So the clinical usage of medicine should be as per the MEURI, that is monitored emergency use of unregistered interventions, or WHO, and also as per the Indian guidelines. If a strong ethical base of empirical evidences of safety and efficiency of the treatment protocol, what I just explained earlier, is available, then the prescribed Ayurvedic protocol fits into the framework of MEURI. Then the simple and safe measure of Ayurveda can become a part of integrative protocol for prophylaxis and treatment of COVID-19. So in concern with the benefit of the large population, this management protocol seems to be very, very appropriate. Expecting the global acceptance, let us apply Ayurvedic principles in handling the different symptoms or stages of COVID-19 through Ayurvedic medicines. I repeat and I stress on it that let us use Ayurvedic medicines. It's high time and need of the hour. Well, with this I end and I thank you, and I thank because the references, what are all the matter I have received are from the courtesy of Guidelines for Ayurveda Practitioners for COVID-19, first report and recommendations published by Ministry of Ayush, and Ayurvedic Diagnostic and Management Protocol for COVID-19 by Dr. Raghavendra Naik, by Dr. L. Mahadevan, and by faculty members of Ashtangam Ayurveda Chikitsalayam, Kerala. Thank you all for your patient hearing.
Thank you, ma'am. The whole presentation gave us an ideology about the detailed Ayurvedic approach to manage COVID-19 based on system involvement. Thank you, everyone. We are happy to hear you. Any doubts, clarifications, or suggestions regarding all the sessions of Tattva Prabodhini, it can be mailed to gamcwebinar@gmail.com. These will be discussed in the panel discussion on 10th November. For the afternoon session, we have Dr. Sidram Gulet sir and Dr. Ashwini madam. So please stay tuned at Tattva Prabodhini channel by 2:30 p.m. Thank you, everyone.